In the first 20 days, you will take HCG, 2000 IUs every other day, Clomid 100 milligram per day, 50 milligram in the morning and 50 milligrams in the evening, Nolvadex 40 milligrams per day, also 20 milligrams in the morning and 20 milligrams in the evening. During this phase, you are activating the testicles with HCG. The reason for using Clomid and Nolvadex here is mainly to control estrogen, since HCG will increase the rate of aromatization. And if estrogen levels get too high, that will send a negative feedback signal to the brain and can cause further shutdown of testosterone production. You may also develop gynecomastia or other estrogen-related side effects if you don't keep estrogen under control. Before we start this video, I just want to make something clear. I am not an advocate for doing PCT if your goal is to use anabolic androgenic steroids long term. For example, if you plan to compete in bodybuilding, then I personally believe that blasting and cruising is a better and more stable approach, rather than coming off completely between your cycles. I actually made a dedicated video about this topic. I will link it in the description below if you want to check it out later. Now, there are really only two scenarios where I find doing a proper PCT makes sense. The first one is for fertility reasons. Some people are lucky, they stay fertile even while on a cycle, without using any additional medications like HCG or HMG. Others may need to stay on TRT, but they still use fertility drugs such as HCG and HMG, and they can still successfully conceive without fully coming off. And then you have the third group, people who need to drop anabolic androgenic steroids completely and run a full PCT in order to get fertile again. So, in that case, doing a PCT has a very clear and valid reason. The second scenario is if someone decides to stop using anabolic androgenic steroids altogether. Maybe they are done competing, or maybe someone tried anabolic androgenic steroids and realized it is just not for them, and it is time to start a new chapter in life. In that situation, running a proper PCT absolutely makes sense. So, to understand how to do PCT and why you should use specific drugs to restore your testosterone production, you first need to understand something called the HPTA axis. That stands for hypothalamus pituitary testicular axis. This system is what controls testosterone production in your body to keep your hormone levels in the right balance. As you can see, there are three main levels in this system. The first level is the hypothalamus, located in your brain. When it senses that testosterone levels are low, it releases a hormone called GnRH, which stands for gonadotropin-releasing hormone. GnRH then sends a signal to the pituitary gland, that is the second level of the axis, telling it to release two other hormones, LH and FSH. LH stands for luteinizing hormone and FSH stands for follicle stimulating hormone. LH is the primary one. It sends the signal to the Leydig cells in your testicles, telling them to produce testosterone. FSH, on the other hand, it helps support sperm production. When testosterone or other hormones like estrogens or progestins are produced, or when you use any kind of anabolic androgenic steroids, that sends a negative feedback signal to the brain, telling the hypothalamus to stop the signaling. When the levels drop again, the hypothalamus restarts the signal. It is the natural hormone balance loop of the body. So after finishing your cycle, and once the level of androgen starts to drop, the hypothalamus senses that change pretty quickly. And in most cases, it will be able to start sending the signal again to produce testosterone. However, the main problem now is not the hypothalamus. The real issue is the testicles. During the cycle, due to complete shutdown, they basically stop working, and over time, they shrink. If you don't use it, you lose it. And now, the testicles becomes a bottleneck for recovery. Your brain can send the signal, but your testicle cannot respond properly. So, to stimulate them again, you need HCG, which stands for human chorionic gonadotropin. HCG is basically a synthetic form of LH. It sends the same signals that your pituitary normally would, telling the Leydig cells in your testicles to produce testosterone again. That is why, in my opinion, it is much smarter to use a small amount of HCG during the cycle, something like 250 IUs twice or 3 times per week during your cycle, to maintain the size of the testicles to some degree, and that can make the recovery much easier instead of waiting until the end of the cycle when the testicles are completely shrunk. But using HCG alone for PCT is not enough. You will also need two other important drugs. The first one is Nolvadex, and its chemical name, tamoxifen citrate. And the second one is Clomid, and its chemical name is Clomifene citrate. You can also replace Clomid with Enclomiphene, which is a cleaner and a better version of Clomid. It works the same way, but with a fewer side effects. So now the question is, how should you dose them and for how long? There are a lot of protocols out there, but in my opinion, the best and most proven one is the Power PCT developed by Dr. Michael Scally. Dr. Scally is an American physician and hormone specialist who has been working with anabolic steroid users for decades, and one of the first doctors who actually studied how to restore HPTA naturally after steroid use, not just in theory but with real-world clinical results. And he has successfully helped hundreds of patients fully recover their testosterone production after using anabolic androgenic steroids. So, when we talk about the Power PCT protocol, we are not just talking about a pro-science method from a forum. This is clinically proven recovery protocol developed by one of the best experts in the field. And personally, I have run the same protocol with some of my clients as well. And every single time, they have recovered completely. Now, let's talk about something that is crucial in this protocol, the timing. So, when you should exactly start your PCT? Most knowledgeable people recommend to wait until all the esters clear out of your system completely, until your testosterone drops to zero, then start taking HCG. And yes, that makes sense and not bad advice at all, because you are waiting for the suppression from exogenous hormones to end before restarting your own natural testosterone production. But here is the problem. When you do that, there will be a gap between the time your testosterone crashes and the time your testicles start to produce testosterone again. During that gap, you feel terrible, low energy, mood swings, no libido, and the most important thing, it will be much harder to maintain your gains that you made during your cycle because your testosterone levels will be extremely suppressed. That is where Dr. Scally's approach is completely different. He doesn't recommend waiting until your testosterone levels hit zero. Instead, he advises to start your PCT a little earlier, right when the esters have tapered down to around TRT levels. That overlap makes the transition much smoother. For example, if you were running testosterone enanthate at 500 milligrams per week, its half-life is roughly about 5 to 7 days. So if you stop today, after about 1 week, you will still have around 250 milligrams left in your system. And after another week, you will have about 125 milligrams, which is roughly a TRT dose. That is the perfect window to start your PCT around 10 to 14 days after your last injection, if you were taking 500 milligrams testosterone enanthate per week only. This overlap ensures that while the esters are clearing out, you are already stimulating recovery, avoiding the hormonal crash and making the transition much smoother. Of course, the timing will depend on the compound and dose you have been using. If someone was using a higher dose, say a gram of testosterone enanthate per week, then they would probably need to wait around 4 weeks before starting PCT, because it takes longer for those esters to taper down. Now, let's break down the structure of this protocol. It is divided into 3 phases. In the first 20 days, you will take HCG, 2000 IUs every other day, Clomid 100 mg per day, 50 mg in the morning and 50 mg in the evening, Nolvadex, 40 mg per day, also 20 mg in the morning and 20 mg in the evening. During this phase, you are activating the testicles with HCG. The reason for using Clomid and Nolvadex here is mainly to control estrogen, since HCG will increase the rate of aromatization. And if estrogen levels are get too high, that will send a negative feedback signal to the brain and can cause further shutdown of testosterone production. You may also develop gynecomastia or other estrogen-related side effects if you don't keep estrogen under control. In phase 2, which is from day 21 to 30, you will drop HCG completely and continue with Nolvadex 40 mg per day and the Clomid 100 milligrams per day, split it into 2 doses, AM and PM. By this point, your testicles should have returned to their natural size after using higher doses of HCG for an extended period. And now the real role of Clomid and Nolvadex begins to shine, as they help enhance the release of the LH and FSH, which in turn stimulates natural testosterone production once again. In phase 3, which is from day 31 to 45, you will drop the Clomid and continue with Nolvadex 40 milligrams per day for the final 2 weeks. This phase helps you taper the drug slowly, allowing testosterone levels to stabilize naturally, while still maintaining pituitary stimulation for a smoother transition to full recovery. So overall, the total PCT duration is 6 weeks. Of course, this protocol can look very aggressive for some people because the doses are quite high, and to some degree, that's true. And of course, it is not always needed for mild cycles. You might get away with half the doses, something like 1000 IUs of HCG every other day, 20 milligrams of Nolvadex daily, and 50 milligrams of Clomid daily, or you can use Enclomiphene instead. It really depends on the length of your cycle, the doses, the compounds you used, and the type of the esters. Something like nandrolone will require a very aggressive PCT, while something like low-dose testosterone plus an oral can be recovered with much lower doses. But in general, I would still highly recommend using all of the 3 compounds, HCG, Nolvadex, and Clomid, or preferably Enclomiphene in any case, and running a full 6-week PCT. Because most people who complain about losing their gains after a cycle usually do a PCT that is too short or too mild. And honestly, I would rather be slightly on the aggressive side than run a mild PCT. I really don't see any long-term harm from using these doses for 6 weeks only. Maybe for some people, Clomid can be a little bit harsh, and it may even cause a bit of depression or mood issues. But remember, you are doing that for 4 weeks only. And as I mentioned earlier, you can simply replace it with Enclomiphene. But what does really hurt is finishing your PCT, waiting several weeks, doing blood work, and realizing you didn't recover. And now you have to start all over again with a stronger protocol that wastes time, money, and energy, and it delays your progress. Also, I would highly recommend that you use pharma-grade products, especially HCG, so you can be sure the doses are accurate, consistent, and effective. Another very important point is doing a blood work before your cycle, so you know your exact baseline levels of total testosterone, LH, FSH, and all your other health markers. That way, after you finish PCT and do another blood test, you can compare everything to your baseline and know whether you truly recovered or not. Because imagine this, your baseline of total testosterone is actually 500 nanograms per deciliter, but you didn't know that. Then you do a blood test after PCT and it shows 200 nanograms per deciliter. If you only look at the normal range printed on the lab sheet, which might say something like 200 to 900 nanograms per deciliter, you might think you are fine and that you recovered. But compared to your baseline, you didn't recover at all. And then you start making the wrong decisions. And a couple of years later, you find out you are basically forced onto TRT for life. So that baseline blood work before your cycle is extremely important. Now, regarding when to do blood work after PCT, I would wait at least 6 weeks after you finish your PCT before testing. Doing blood work immediately after PCT would be completely useless, as the results will be highly influenced by the PCT drugs and won't reflect your true natural testosterone production. So what should you expect during this recovery period? First of all, you will have an initial drop in weight, and that is completely normal. You will lose glycogen, water, and that enhanced muscle fullness. But don't freak out, that is not muscle loss. And to be honest, you will never have the same fullness after a cycle, even if you are on TRT. That is just part of coming off. You will also notice you get less pump during your workouts, your body fat might increase slightly, you may experience some mood swings, a bit of low motivation, and your libido will decrease for a while. So during this time, you really need to stay disciplined and keep training hard to maintain as much of that new muscle tissue as possible. You have to go to the gym with the mindset that you are still training to build muscle, even though that might be difficult to happen during this recovery phase. Also, I highly recommend you stay on your diet, don't start eating junk food, and don't go either into a deficit. Stay at least at maintenance or ideally a slight surplus. If you try to cut during this period, you will negatively affect your testosterone recovery. Just look at natural bodybuilders. As they get closer to their shows, their natural testosterone levels crash. And it takes months to recover once they start eating again and regain some body fat. Also, optimize your sleep and keep stress low, because that is when your hormones recover best. And above all, be patient. Some people recover fast and others may take 6 months or even longer. It is temporary, just stay consistent and you will stabilize. I also have to mention that you may run into a problem when it comes to splitting the doses of HCG. Most HCG products come in 5,000 IU's vials, and sometimes they even come in ampoules. So once you break it, you technically have to use the entire thing. So the question becomes, how do you split that into 2,000 IU's doses or even smaller doses without ruining the product? Because if you do it incorrectly, you can easily degrade the HCG and make it completely ineffective. That is why I made a dedicated video on this topic, where I explain exactly how to do it step by step. So if you want to learn how to reconstitute and store HCG, click on this video to watch the full guide.